Hello, today I'll be demonstrating the proper technique on how to insert a nasogastric tube. First, I go and verify my order. I check for accuracy with the MAR. Next, I go and identify my patient. I get them to state their name, their date of birth, and I check their armband. Next, I gather consent from my patient. The patient has already given consent for the procedure. Next, I gather my supplies. I check my supplies and I make sure that the supplies are current and in date. Okay, I do my right checks. I check the right patient, the right route, the right procedure, and the right time. All of it has been verified. So once I've gathered my supplies, I provide privacy for my patient. I wash my hands. I don clean gloves. Once I don the clean gloves, I assist my patient into a high powers position. Once my patient is in a high powers position, and I've already explained the procedure. Next, I remove my supplies. I take my tubing and I measure it out. You measure from the end of your earlobe to the tip of your nose down to your xiphoid process. And the xiphoid process is normally determined at the end of your sternum. Once I've measured it out, I take a piece of tape and I mark that area. Next, I go ahead and I open up my lubricant to lubricate my tubing ends. Go ahead and apply that tubing to the lubricant. I check their noses, their nose for occlusion. Both nares are free and clear, and they're breathing without any difficulty. I go ahead next. I take the drape and I drape my patient to protect their clothing from any kind of spillage or anything that may happen during the procedure. Once I've draped them, next I give them a basin. I have a cup of water or ice chips at bedside just in case they would prefer while I do the advancement of the tubing. So once I've already got my patient in half hour position, I've lubricated my tubing. I have my tubing in place. So I allow my patient, while sitting back, I advance the tubing slowly down the nose. I ask them to swallow, tuck their chin while swallowing, and this will help and advance the tubing down to the, I advance it slowly. Once I get down to my landmarking, I take and I remove the tip. I take my piston syringe and I withdraw some of the stomach content and I apply it to my basin. I take a pH stick and add it to that secretions. Once the pH stick is indicated, it normally anything less than 5 is a good indication that it is in the stomach area, it's in the correct placement. Next, you can also you send them to X-ray to verify placement. Once it's been verified, you can secure the tape, secure the tubing with tape to their nose. Once it's been verified, you make sure that the blue port is not accessed, it's only used for air purposes. So this is for your feeding, suction, or whatever the regular port. So once it's in place, it's secured down. You ask the patient, see how they're tolerating, answer any questions that they may have. The bed is in normal position. Call out and reach. Remove your supplies. Wash your hands, and you document. Now, to remove the tubing, you verify the order again. Next, you would provide hand hygiene. You would wash your hands and also apply gloves again. You would disconnect the tubing from any kind of suctioning or any kind of feeding pump or whatever that it may be connected to. Okay, you would drape your client again for any kind of spillage or anything that may, you know, uh, waste on their clothing or anything. Okay, and now you ask that patient, once you've disconnected it, you ask the patient to take a deep breath, hold their breath, and you remove it slowly and steadily until you finally got it removed. You provide them with a Kleenex or a towel to wipe their hands or a nose or anything. Um, you wash their hands. You document any kind of how the patient tolerated it. Make sure that your patient is safe. Answer any questions. Call out and reach. Remove your gloves. You just remove your supplies. Wash your hands and document. Thank you.